As we move through this year of transition, with the School of Osteopathic Medicine moving to Rowan University, with our other schools moving to Rutgers, and with the spinoff of University Hospital into an instrumentality of the state of New Jersey, I thought it important to spend some time reflecting on UMDNJ, where we started and where we are today. Periods of transition and change are difficult for most of us. We don't like change, even though, as the cliche frequently says, the only thing that is constant is change. When we look at the history of the University of Medicine and Dentistry, we see a history that's filled with change. Change that, for the most part, has made the university bigger, better, and stronger. Throughout our history, the vast majority of our faculty, students, and staff have brought high levels of dedication, compassion, integrity, and competence to their work. Like all institutions, we've seen our share of difficult days. However, we've seen our share of triumphs. From the beginning, UMDNJ has been dedicated to the pursuit of excellence in health professions education, clinical care, research, and community health. The faculty in several of our schools have been leaders in the understanding, treatment, and prevention of HIV/AIDS. Dr. David Alland from New Jersey Medical School has led a team of investigators who invented a new rapid test for tuberculosis that's been adopted by the World Health Organization. Dr. Jeff Carson at Robert Wood Johnson Medical School has significantly impacted the way we think about the use of blood transfusions after surgery. Dr. Bob Nagel from the School of Osteopathic Medicine has made some promising discoveries that may one day lead to an effective test for Alzheimer's disease. Dr. Chris Del Nevo and her colleagues from the School of Public Health discovered that smokers who use menthol cigarettes have much more difficulty quitting smoking than do smokers of non-menthol cigarettes, and that minorities are much more likely to smoke these mentholated cigarettes. The UMDNJ School of Nursing was the first in New Jersey to offer a doctorate in nurse practice, and SHRP has graduated over 10,000 allied health professionals during its 35-year history, with programs that range from high school certificates to doctoral level degrees. New Jersey Dental School is the largest provider of oral health care to Medicaid and special needs patients in the state. And researchers from the Graduate School of Biomedical Sciences have made a number of important discoveries that have led to the creation of startup companies and tech transfers. As most of you know, UMDNJ is home to institutes and centers of excellence focused on environmental and occupational health, cancer, infectious diseases, neurosciences, oral health, cardiovascular disease, ophthalmology, ENT, and many others. It is our clinicians who provide care to first responders from the World Trade Center these many years later. It is our clinicians who provide care to children in foster care throughout the state of New Jersey. It is our clinicians who provide care to those incarcerated in New Jersey prisons. I therefore would like to spend time, these next few minutes, remembering our past so we can look to our future. Because at the end of the day, you can't know where you're going until you know where you have been. Now, as Shakespeare said, what's in a name? That which we call a rose, by any other name, would smell as sweet. We've had a lot of names. In 1954, Seton Hall University started the College of Medicine and Dentistry. About a decade later, Seton Hall College of Medicine and Dentistry was going broke, so the state of New Jersey took it over and created the New Jersey College of Medicine and Dentistry in 1965. This is the inaugural class from New Jersey Medical School back in the day. Things have changed. The New Jersey College of Medicine and Dentistry had some of its educational program at Newark City Hospital, which was eventually renamed Martland Hospital, but much of the teaching actually occurred at Jersey City Medical Center. As we look to the past, we see, in fact, some things actually don't change. Perhaps our sideburns are a little shorter, but in truth, we can never forget that caring, compassion, a smile, and touch remain important components of our work as healthcare providers. While some things don't change, thank goodness our labs have. And we have come a long, long way from those days. The Harrison S. Martland Medical Center opened in 1958. Indeed, there was a time when the Bergen building was new and the heat and air conditioning worked. Here we see a view of Martland Hospital with the old Newark City Hospital in front. I also think it important to look at the neighborhood surrounding this institution, because by looking at that neighborhood, we get a better sense of the loss that is so often reflected by people who live in this community when they think about the development of this academic health center. We see here a student from the Martland Hospital nursing program. And yes, I will remind you, there was a time where nurses wore caps. Here we have the land that was being cleared for the Interim buildings. These are the Interim buildings when they were sort of new. These are the Interim buildings in 2002 when they were still not quite so new, 10 years ago. And they were supposed to be Interim then, and of course if you look across the street, they're still there and still, of course, Interim. In 1962, Rutgers started the Rutgers Medical School. It started as a 2-year basic science medical school and enrolled its first students in 1966 and graduated its first 4-year class in 1974. That's the hole in the ground that was to become Rutgers Medical School. And here we have a newsletter from 1969 showing the development of that campus. And I will remind you, as things change, things stay the same, as many of us are about to take on the Rutgers moniker yet again. In 1970, Rutgers Medical School was merged with New Jersey Medical School, New Jersey Dental School, and the Graduate School of Biomedical Sciences to form the College of Medicine and Dentistry of New Jersey. Dr. Stan Bergen was named the first president of the College of Medicine and Dentistry of New Jersey on July 1st, 1971. Here we see the College of Medicine and Dentistry of New Jersey, New Jersey Dental School at Jersey City Medical Center. This is clearly a staged picture. I mean, these are kids coming out of the dentist with smiles. No offense, Seal. Forget it. While the medical school moved to Newark in 1967, the dental school actually did not move to Newark until a decade later in 1977. Here is what I'm presuming to be a graduate student in one of the labs in the early days. Here are medical students learning anatomy, and yes, big hair was in. Here we have the UMDNJ Rutgers Medical School, that campus on the New Brunswick, in Piscataway. And here is a student from that era. And let's admit it, many of us kind of looked at like that at one point ourselves. This is one of my favorites. An important reminder. This is how we used to make phone calls. Some of us in this room remember being on call and having to search around for the pay phone somewhere out there. These are obviously very scarce these days. The School of Osteopathic Medicine opened in 1975. It was established then. And some will remember that in the beginning, the basic sciences were taught in conjunction with Robert Wood Medical School on the Piscataway campus. This is the groundbreaking for the Academic Center in Stratford. And this is the early Stratford campus showing the Science Center. This is SOM's first graduating class in 1981. Find those two women. And here they are today. Talk about we've come a long way, baby. The School of Health-Related Professions was founded in 1976. And here we have a picture of the dental hygiene program that's on our Scotch Plains campus. Around that same time, there was building of the dental school being under construction. And here we have another view of the relatively new dental school. And here, the construction of College Hospital, which of course we now know today as University Hospital. In 1981, the University of Medicine and Dentistry of New Jersey, through legislative action, came into existence. By the early 80s, 30% of our medical students were women. We had cool flags by then. Some of you will remember these flags. We still have them today. And these are graduates from the UMDNJ Rutgers Medical School graduation. We show here the building of the Doctor's Office Center. And here we have the original Chandler Health Center in New Brunswick. Again, progress, not quite enough. We still need a new Chandler yet today, but progress nonetheless. In 1992, the School of Nursing was founded. And yes, by then, our students have given up caps. This is a group of nursing students at their penning ceremony. Our last school was added in 1998, the School of Public Health. And amongst the many wonderful things that are done in that school, I think one of the least well-known, perhaps, is the hazardous materials training that the School of Public Health does not only in New Jersey but also in the region. Around this same time, we see the building of the new Behavioral Health Sciences building here in Newark in 2002. The Child Health Institute was started in 2004. This is the Child Health Institute today, and as it was completed in 2005. And we have our first student housing that we opened in 2006. I wanted to show this slide to remind us how relatively young we are in comparison to many of our regional peers. I would say that in light of that, these accomplishments are even more monumental. In the fall of 2011, we enrolled 7,212 students, 83% of them from the state of New Jersey, 2/3 of them women, and nearly half of them from minority groups. These are our students. These are our future. We have much to be proud of. We have much to look forward to. As we move forward, we must keep in mind all the changes we have survived and thrived under. The good news is that while our name will again change, it is my hope that our commitment to excellence in the training of health professionals, in patient care, in research, and community service will remain strong. During these next 276 days, we must ensure that the integration process does not interfere or compromise with our obligation to the students we teach and the patients we serve. However, I encourage all of us to spend a few moments reflecting on from whence we've come and then reflect on to where we can go. Because it is our faith and hope and beliefs that we can not only transform the physical nature of our campus, our surroundings, but also transform the very nature of our work that will provide us with the hope, the challenge, and the commitment to continue to do our jobs as best as we can and with as much commitment as we can muster in light of the thousands of people who are relying on us to get this right. One of the things I reflected on even in this relatively short period of time is, if you do the math, we have provided over 1 million patient care encounters in UMDNJ. We have provided care and saved lives to thousands and thousands and thousands of people in this state. We have educated thousands of students. We have contributed significantly to the healthcare professionals who work in all regions of the state of New Jersey. And we have done this under some pretty adverse conditions at many times. And yet we have persevered, and we will continue to persevere. Because at the end of the day, a change in our name does not ultimately change the motivations that led many of us to do this work, and that will lead us to continue to do this work, no matter what banner we reside under. Lewis Carroll said, "If you don't know where you're going, any road will get you there." What I am suggesting to you is that based on where we have been, we have a very clear sense of where we are going. We have a very clear direction in which to move in order to achieve the opportunity that is presented to us by this new legislation to get New Jersey on the map in a way that it has never before been on the map in terms of the life sciences and the health sciences. If we look at this as an opportunity to grow and get stronger and get better, then hopefully in the next 30 years, someone besides me will be standing showing pictures from our day and showing the enormous progress that we will have continued to make. For some of us, we will always be UMDNJ in our hearts, and that's okay. Because quite frankly, for some, we remain CMDNJ or NJ. Who can get all these letters right? It is our work and commitment that defines us, not our names. I look forward to walking this journey with you over the course of this year. We will continue to do this. We will continue to celebrate our past while we contemplate and work to strategize with our new partners in how we move forward productively and effectively. And I thank you for that.